Hello, Dr. Nilarat. It's such a pleasure to have you on with us. We're so excited to have and to listen to your journey, to have you share your journey. We know you've gone through some pretty significant health challenges and that you've been on this recent journey of healing with this new cellular technology. And so we're excited to hear about that, right, Liana?
Yes, absolutely. But before we get into that, would you mind just introducing yourself a bit?
Hello, everyone. I'm Assistant Professor Dr. Nilarat, Narula. I have been in the medical field for around more than 30 years, 32 years. My field of work has been quite diverse. I started off with being a resident, working in the Faculty of Tropical Medicine in the Tropical Medicine Hospital as a resident. And I also earned a diploma in Tropical Medicine and Hygiene from there. Then I joined the department that works on preventive medicine and social medicine, and research-based epidemiology. So I have a master's degree in epidemiology as well, medical epidemiology. I was working there for 10 years. Then I decided to quit because of my health issue. I was diagnosed as having autoimmune condition around 3 years before I decided to leave my job. I was having symptoms of like weakness, weight loss, fever, fatigue, and then I was training as a resident in ophthalmology. So I started noticing that my hands shakes and I couldn't hold a retractor for a long time in the operation for the eyes. Like it doesn't take much. And then I started noticing that I'm dropping things. So it took me quite a bit of time to get the diagnosis. Then they did an MRI and they found out that I have inflammation of the spinal cord and the nerve supplying my arms. So that's where I started my journey into a holistic approach. As a researcher, I always have a question in my head as to what happened, when, why, how, So they told me there's no way out of this. There's no treatment for you. You can go on an immunoglobulin injection every month, but that doesn't guarantee that you're going to go into remission. But it did help me. But then 3 years of that was a lot. And after the research, I found out, oh no, there is some other ways you can get out of this. I mean, you change your lifestyle, you change your diet, less stress, rest more. And I did that. I left the job. I started with working only 3 half days a week. And the rest of the time I spent resting, being with my daughter. She was only around like 3.5 years old then. It took me 6 months, 3 months of diet control, and started with exercise. I was doing, I was able to walk for only around 2 minutes in the beginning, and I would be breathless. But I kept at it until I could walk for 20 minutes. And then I joined yoga. And after 3 months of yoga, I was a new person. So that's just the gist of it. My journey is like 20 over years, 23 years. So in between, I kept on getting flare up and everything. And it's a long story. But just to let you know is that I believe that our body can heal itself. I believe that if you treat your body right, provide the right nutrients, the right rest, give it rest, and be kind to yourself, and a lot of love, self-love, you can get out of any disease and you can live happier. But you have to find that path to love yourself.
Beautiful. Needless to say, we relate to that, and to hear it coming from, our heart goes with you, right, to this, sharing to others. There is hope. There is another way, and it also shows your determination. I'm going to call you Dolly, as your friends call you. That
Yes,
you're not going to give up. Like, you're not going to take a sentence of saying you can't, there's no way out for the final decision.
I never give up.
Health into my own hands.
Yeah.
So you're implementing other holistic practices, I'm understanding. And then recently, I believe you were introduced to the technology. Is that correct?
Yes. Rachel, a friend of mine, we've known each other for many years, like almost 10 years, I think. Almost 10 years now. Started with we were in the same group, of women. It's a women's group, like we get together once a month on Thursday. So she introduced me she knew about my health issue. And then she's trying to tell me what it's all about. So I told her, I said, let me look into it and understand it first, because I want to know how this works, because I've been trying out many of them. There are some brands that I'm totally against because they use a lot of soy-based products and preservatives. It does look good in the beginning, but in the end, people get food intolerances. By the way, another approach of mine is looking into food, what my patients are eating. And what is it that is causing them, to have this problem? All my patients, I would go to the gut first and ask them, do you have any gut issues like bloating, constipation, diarrhea, and stuff like that? Because gut is the root, the root cause of diseases. Is your gut is your health. Your gut is your second brain. Depression can be from the gut as well. So I incorporated all that. And it really helped me big time. Started with myself though.
Tell us specifically, now you've been for, a month now, you've started on this cellular health healing journey. Can you tell us a bit about that?
Oh yeah, definitely. Okay. I knew about this cellular technology, and I was introduced to the gel and the water as well. But after looking into it for 2 to 3 months, I agreed to start. This year, since end of January, I've been ill and hospitalized twice. I had diverticulitis, an infection of the colon, and it was 4 days of admission with heavy antibiotics, and I got discharged. Within a few days, I caught a cold and I ended up with bronchitis. Just within 10 days, I'm back in the hospital. I was back in the hospital. That time, autoimmune flare-up was terrible. I was having like low heart rates, all of a sudden my blood pressure would drop, my heart rate would drop, and I would be getting dizzy and all that. And after that admission, my gut was haywire. And it was very hard for me to sleep. So I got to a point where when I understood everything, I looked into it and it says mitochondria. It targets the mitochondria. For me, as a doctor, I know that mitochondria is a powerhouse of our body. And we need that in our cells, except in the red blood cells, you don't have mitochondria. So you need that powerhouse. It generates energy, right? And you require a lot of cofactors and stuff like that. So when you are exposed to any chemicals that can cause the damage to the mitochondria, your mitochondria doesn't function well. We call it mitochondrial dysfunction. I got to the point where I understood that this technology targets the mitochondria by assisting the healing of the mitochondria, by enhancing production, formation of new mitochondria, fresh ones, and also by increasing glutathione. That is a very one of the strongest antioxidant. Through all this mechanism, what I understood and where from the articles that I read, that it also enhances stem cells production in your body. Now, with all that mechanism, for me, it's like a big wow.
Yeah.
Because your mitochondria declines as you age. It's very healthy when you're young, but as you age, people age because of mitochondrial dysfunction.
Yep.
You get diseases because of the dysfunction, in various cells in your body. So that's like a big wow for me. And I said, you know what? Enough is enough. I'm going to start myself on this, because I got answers from my doctors that says, we don't know what we can do for you anymore.
Right.
They found I was having low-grade fever for a month after all the antibiotic. I was having inflammation of my hip. I was having headache and dizziness, literally like out of the blue every day. And I just didn't have the stamina to function. There are days I would be in bed the whole day. I did my own investigation and I found out that I have 2 viruses in my body. And that freaked me out. And there's no treatment for Epstein-Barr. There is for CMV. But my doctor said, we can't give you the medication because of your condition. Wow. It's going to suppress your blood cells formation. I looked at her and I said, so what do I do now? I was so distraught. So she sent me to this guy, a rheumatologist, who's like heaven sent at that time. And I agreed to go on his medication. But I also started this water, which is a technology that's amazing. I was told to start just only 60 ml a day. I did that because autoimmune can flare up if you go and mess up with it, too much, if there's too much of triggers. And then I stepped up to twice a day, 60 ml after a week, but only with 60 ml and applying the gel. There's a gel that comes with it, and it's called Redox Gold. 5 days. It took 5 days, and I realized I was able to walk without pain. Wow. I was having hip pain for a month. Anti-inflammatory was given to me. I had allergy to it. My doctor said, you go for the laser treatment and ultrasound treatment twice a week, and let's see how it goes. Frankly speaking, it helped only for a while. You just feel relieved for some time. In the end, he said, the last thing to do is to inject steroids into your joint. I said, no way, I'm not doing that. So I was like, what am I going to do now? I started on this, and within 5 days, I was walking pain-free. Within 2 weeks, I don't have pain anymore when I sit cross-legged.
Wow.
And after 2 weeks, I noticed that I sleep better. Not only that, I noticed that it can be my SOS when I am in a stressful situation, after the stressful situation. And I increased my dose. I just listen to my body and I do that. And I felt like amazing. I started using more for various purpose, like put it in a spray bottle and use as a toner for my face. I mean, I'm learning a lot of things from here. The best part of it all is I have been getting good quality sleep. I was on sleeping pills, 3.5 tablets after my second hospital admission. Plus, the chest medicine doctor gave me a prescription of a medication that works on my brain to help relieve pain. You know, and I didn't like it. Didn't help. Nothing helped. This is like amazing for me to be able to sleep again. And now I've cut it down to 1.5 tablets.
Brilliant. And this is in such a short time.
Very short. I've been on the 2.5 for the past year. That's like before I go to bed. And then when I got into the stress, because during my time of admission, there was a stressful event at home. Someone passed away in the family. So it was pretty stressful then. So everything puts together, like, it's just like, you know, I just collapsed after that. And seeing the results within 2 weeks, I have now increased my tool on certain days to 3 times a day.
Beautiful. Slowly, you've brought it up. Now, in a few words, say how your life has changed.
I feel I've got my focus back. I mean, I used to have a lot of brain fog, and I was like, I wasn't able to read or concentrate on anything for like over a year. After this redox, I noticed as each day passes, wow, how I regained back a lot of memories. I mean, I was in the state when I was thinking that I can't practice anymore.
This is just the start. Go, Marisha.
Sorry, it is just the start. You'll see as you go along. I mean, we've been on this journey now for me 4 years, and it keeps getting better.
Yeah.
I wanted to ask you, Dolly, what has been some of the most surprising lessons in the way that healing really works from what your journey and what you've experienced, especially in the past month with redox? What is it that are there revelations to you, though, with all of your knowledge already? Are there things that you can speak to as to what have been surprising lessons on how healing really works?
I would say healing really works if you address the root cause. Go to the root. And for me, mitochondrial dysfunction is the root cause of disease. When I did my regenerative medicine course, I found out that, and I was so excited. But you know, it's so difficult to get the mitochondria back to its healthy state. There were several supplements that you can take, but how long can you go on those multiple pills? Frankly speaking. And there are other modalities too that you can do. I used to work in Vital Life, the Nilarat hospital before. I mean, I was there for 3 years. And it is like, you have to be so consistent. The cost is very high. It's not accessible to everyone. It's so difficult to get it. If you don't have that much amount of cash, you can't get into that treatment that would guarantee your mitochondria being, healthy again. So for me, what is amazing is that reading it and learning that it works that way, using it and feeling it, that it's working on me that way. My gut is so much better. After my second hospital admission, I wasn't able to eat. I was like, every bite that goes in will cause pain. And now I can digest food.
It's
And
incredible.
I don't have that bloating. I don't need to take laxative, no constipation. I'm not actually on probiotic at the moment. Somehow, I chose the Ayurveda concoction that my friends made, and that's a good way. A prebiotic, more of that, and I'm good. I'm good.
Give the body what it needs, and then watch the miracle happen. I always like to remind people: give the body what it
Yeah,
needs, watch the miracles
yeah.
happen. Now,
Listen to your body.
yes,
Listen to your body. You, me, I mean, we're different. So you have to understand your body. You can't just go by what the book says or what people tell you. I always tell my patient that. I said, these are my advices for you. I don't know how it's going to work out, but along the way, when you do, as you go along with me, please take note how your body feels.
yes, individual.
You know, yeah. You don't just cling on to what I tell you. I mean, these are my advice from my experience, but you have to listen to your body and you adjust accordingly. And please keep me informed. I'm very open, I'll adjust it for you.
Love it. And if just thinking of if you'd have a message for anyone who's feeling stuck or disempowered or in that they about their health and how to get back into vitality and health, what would your advice be?
Okay, this is going to be funny coming from a doctor. Number one, to get you out of that dark place, to get you out of that low state of, mental health, having to go through chronic diseases or ailments or whatever kind. I would like to advise everyone to stop, think, and be grateful for what life has given you. A lot of diseases stems from emotional imbalance. A lot of diseases comes from, people having issues in their life that they cannot handle, and they just keep that in, and it turns into manifestations of symptoms.
Yep.
So not necessarily there's pathology involved. Start with being grateful, because that's where you're going to start building up the feeling of love for yourself. And from there onwards, when you start loving yourself more, you will look into anything that would nurture yourself and that would heal yourself, and you will not sabotage yourself. Everyone, I would say, I always interview my patient, and I will always ask them one question: is there anything you are feeling uneasy about, or you're stressed, or are you not able to sleep? Is there anything that's bothering you emotionally? And 90% of the time, if they open up, they open up. I mean, I'll have to have a box of tissue paper next to me. So to be able to heal yourself from this, whatever condition you think you're having and you're hopeless, please just start thanking every little thing in your life that you've been blessed with, and you start feeling the love. And if you're connected to the divine, and you can thank the divine for blessing you every day, you're going to attract more. Things will come to you. You will get suddenly someone popped out of nowhere, telling you their experience, or maybe like you, Liana, someone just came up and say, hey, why don't you try this? Yeah, right. Like for me, Rachel came up to me and said, try it out and see. So that is when you set intentions, when you are balance, when you're aligned, and your body's going to start healing already. You just need something to support you. And you just need people to be there, like-minded people to be there to encourage you and tell you that you can do this. Because when you are sick chronically, it gets very lonely. People around in your family, they're so used to seeing you sick, and there's sometimes you don't get that empathy. So if you are in that place, start with gratitude, work on self-love unconditionally. Don't downgrade yourself. Don't blame yourself. Build up your self-worth and accept and embrace yourself as you are. And you will be able to go on, be more disciplined in taking care of your health, and be more open to the modalities that's being offered to you. And you will get there back to be in the state of health where you find yourself much happier than you have ever been. This is for me, my experience.
Thank you. I think both Marisha and I cannot but have words of gratitude to you for the precious,
thank you.
simple but profound and heartfelt message. And we really hope and trust that this will touch many hearts. And of course, we want to say, blessings to you. Thank you for saying yes to you. Thank you for getting on the call. Thank you for coming on this call with us. And we look forward to be doing a lot more work with you and having you on our channel again.
Definitely. Thank you for having me and allowing me to share my journey. That's been my dream, to reach out to people and share my journey and help them. Really, that's my ultimate dream. It's like, I want to spend the rest of my life doing this.
Oh, bless you. And we are so happy.
Just let me know. Yeah.
So grateful, Dolly. It's like you are so inspiring, and it just echoes and it resonates deeply. Your message is powerful and it's precious. Thank you.
Thank you.
Thank you. Thank you. My pleasure.